Hello, can you hear me?
Yes, please go ahead.
Wonderful. Good afternoon. My name is Kim Boller, and I'm a senior fellow at Mathematica Policy Research. Congratulations, and thanks to all of you for focusing on the issues facing children and families as they negotiate key transitions. What a great morning it was. As policy researchers, my colleagues and I study programs and initiatives that support the most vulnerable families in our country and around the world. Implementation and impact evaluations, systematic reviews of the evidence, cost studies, and data to support program and policy decision-making are all part of informing an evidence-based approach to supporting the healthy development of children from conception to early elementary and beyond. Three themes are central to growing a body of knowledge that informs birth-to-8 policy, practice, and research. First, a systems perspective on early childhood care and education identifies roadblocks that impede healthy development and smooth transitions. By identifying these roadblocks, we can develop and evaluate approaches to prevent them and enhance system integration and coordination. Systems thinking and research requires stepping out of a specific funding stream, domain of child development, or program. We need to think holistically about all potential opportunities to move children's developmental trajectories. Systems thinking has sparked both top-down and bottom-up approaches designed to change resource management and family and child experiences. For example, bottom-up systems approaches include place-based efforts focused on targeting high-quality services by family need, but where every family gets something, from intensive home visiting and help finding high-quality child care to parenting education and support. Research pinpointing which system features are associated with better child outcomes is needed to guide programming and policy development. Second, use of data and evidence in decision-making at all levels supports a culture of quality improvement. Use of evidence is on the rise and informs decision-making, funding choices, and QI strategies. Recent systematic reviews of the evidence in areas such as home visiting, early childhood education and special education, and a brand new one just getting started on out-of-home care and education models that serve infants and toddlers all contribute to policymaking. They help determine which programs are eligible for funding, inform programming choices and professional development strategies, and raise the bar on what it means to conduct rigorous impact evaluations. As we look forward to Head Start's 50th next year, the Office of Head Start's commitment to serving as a national laboratory is worthy of special celebration. Head Start's emphasis on continuous program improvement and a research to practice, practice to research approach has benefited not only the programs and children, but also produced a cadre of applied researchers who use their experience to co-develop and test quality improvement enhancements. Learning collaboratives and breakthrough approaches that support continuous quality improvement hold great promise for our field because they use data as a common language for discussing progress toward outcomes. Third and finally, we need to innovate together. There is not enough existing rigorous evidence of effectiveness in many of the areas important to providing seamless, supportive experiences for children from birth to 8. In many areas, it's time to develop, try out, and evaluate new interventions and create a pipeline of intervention testing. This will keep our evidence base growing, responsive to changing needs, and relevant to our country's increasing diversity. For example, although most states are implementing or preparing to implement a QRIS, these QI approaches apply only to regulated early care and education settings. Little innovation is happening to improve the daily experiences of children cared for in unregulated, home-based care. The NSECE estimates there are more than 3.5 million home-based educators and caregivers. We just do not know enough about what might enhance children's experiences in these settings. Along with innovation in practices, we also need innovation in our research designs.
1 minute, Kimberly.
Quality and outcomes. Thank you. And data collection methods. Investments in measures development affects both research and practice because what we measure often becomes a focus of program improvement. The committee will do our nation's children and families and our early childhood workforce a great service by thinking broadly about innovation. How do we encourage exploration and rapid cycle evaluation to develop new interventions? How could we combine and test the leading features of proven quality improvement, professional development, parent decision-making, and system change initiatives? Approximately 11,000 babies were born in the U.S. yesterday. We need to bring our best thinking and our best research together to be sure that their next 8 years, just 2,900 days, sets them up for reaching their full potential. Thanks again for this opportunity.
Thank you.